Welcome back to another episode of Where's the Teaspoon? Today we're talking to Integrated Community Team Lead Jemma Walker, who's going to be talking to us today about her life as a working carer. So thanks for joining us, Jemma. Can you start off and just tell us a little bit about your caring responsibilities?
Yeah, so I care for my 25-year-old son, George Walker, who has Down syndrome, complex health needs, severe learning disabilities, and autism. And he's a little star, bless him.
Yeah. So 25, so that's 25 years of caring. I'm guessing you've faced all kinds of challenges along the way. Have you got a support network around you, or have you been managing this alone with work? How does that work for you?
So I was widowed very young, so I am remarried now, but yeah, I was on my own for a long time with him, and I have faced challenges along the way of working. So I have worked for the NHS for 30 years, so obviously I've been working for the NHS longer than I've had George. I have come up with quite a few challenges along the way, and that's why I sort of, really want to try and support other carers within the NHS as
Yeah.
well. But yeah, it is. There are all sorts of challenges, and sort of one of my biggest challenges is trying to sort of negotiate everything and trying to bring it all together. So hospital appointments, making sure I can take him to hospital appointments while still working. And he has a care package now, so we have somebody up in the morning to get him up and dress, and then he has somebody in so that they obviously can get him off the bus from his day centre, and then they'll bath him as well. And just sort of, trying to bring all that together can be quite challenging, especially when you've got if they're not very well, or you've got a breakdown in that care. That is quite a challenge for me.
Yeah, yeah. I would imagine you need a lot of pre-planning, a tight diary, and sympathetic colleagues and managers who can adapt.
Yeah, absolutely. And that is so important. And I think that for me, that is the biggest thing for a carer, is that to have that support within the workforce is really important. And I think it will make or break a carer.
Yeah, yeah. So how has your personal experience over the last 25 years, how has that influenced your advocacy work?
I will always stand tall that I've carried on working, being a carer, because not many carers actually are able to do that. And for me, it's been a luxury. Um, and I want to be able to sort of tell that story and to get that across, that actually it is doable. But I'm not saying it's easy, but it is doable. And I will always, I guess, the challenges I've faced along the way, just a couple of examples where I couldn't work at Christmas because when my husband passed away, my mum used to come and help me care for my son. And when he passed away, and my mum was coming and she was working as well, and I couldn't work a particular night, and I was told that I should put him into care. So there's been all sorts of barriers that I've had, working shifts, and I've just thought, why am I just being discriminated against because I'm a carer? This is not right. It's not fair. And I could have just sat down and quit them, because there are times when I've been so low that I thought I can't carry on doing the both. But then I think, no, why should I? I have a skill set, and I'm contributing to the workforce, but I'm a carer. We have to make this work. And so that's when I really stood up and thought, no, this is not right. And if I'm going through this, but I feel like I'm quite a strong person, what are other people going through? And then actually, when I sort of opened a few doors and, looked into it a little bit more, and the amount of carers that had left the NHS because they just couldn't carry on, or that they went onto the bank because they just couldn't carry on doing both, which I just find really sad.
Yeah.
And that's when I thought, no, let's actually do something about this.
So how do you make the move then from being a carer and feeling passionate about this to actually getting into advocacy work? What kind of things did you start to do?
So my first thing was I went to the trust that I worked for before. I went to the senior management and said, this is not right. It's, we need to do something to support carers. I ended up with getting lots of facts. With the 6.5 million working carers, and actually 1 in 7 carers juggle work alongside caring roles. 1 in 3 are actually NHS staff. Now, I sort of went with sort of the figures that the average age for a carer is 50 plus. So if the NHS ended up losing 1 in 3 50-year-old carers, we wouldn't be able to, we couldn't run the service, with the most experienced staff within that, within the pot of the NHS. So we really needed to sort of rethink how we were going to do this. I looked at how we could sort of improve. And the first thing we did was bring in the carer's passport, and that just opened up conversation for managers. So the other thing that, going back a little bit, the other thing that sort of amazed me was how we'd get a manager who was absolutely fantastic with the carers, and it worked really well. And then on another department, you get a manager that just, didn't understand the carers' responsibilities and roles, and they couldn't manage. Well, actually, so we've got with the same trust, but we're treating carers completely different. This is just so unfair. We sort of need to make something that, to recognise carers and sort of to put them into, put that support in before we go into crisis. So we introduced the carers passport, and that opens up a conversation. So managers should have that awareness of the caring responsibilities that carer has. So whether that be caring for your grandma and going in and helping her a few times a week to being a full like carer like me. Do you know what I mean? Like being there night, day. My son's on oxygen as well, so just the whole routine of getting him to bed can take me an hour because I have to put his oxygen on, get him settled. So I think that carer's passport opened up that conversation for that. So it should then recognise all working carers. So all managers should then know that if they've got they've got a carer within their team. Because I think one of the things that I will have to say is carers don't often see the carers because they feel that they're going to get discriminated against. And actually, it's something that I still am almost quite frightened to tell people, because I just think, if they're a problem, they're not going to be able to work 24 hours a day, 7 days a week. And actually, we're very resilient. We've got so much more to bring to the workforce.
Yeah.
So, yeah.
How would you define a carer, Jemma?
So a carer is anybody that looks after somebody else who could not manage without their support. So that could be because of old age, frailty, disability, drug addiction, any addiction, and that includes young carers as well. So what we say with parent carers is, because again, this is a question that I used to get asked a lot. If somebody's got, a 5-year-old, am I a carer? Well, no, you're not. If that child has got an additional need, then they've got a healthcare support plan, or they've got some sort of support plan in place. Then we would then say that yes, you are a parent carer. But being a parent doesn't automatically make you a carer. And I think it's really important to differentiate that, because if you've got a child that you are caring for, there's not the same support network at school. Like George went all the way through special school and special college, and there's no before school, there's no after school, there's no school clubs, there's nothing. It's literally 9:30 you used to start school, you used to finish school at 3:30. So there is sort of, there's a lot of differences between that.
Yeah. In your view, what are the main needs of carers that are still going unmet in the workplace? What is it that carers need more of?
I think first of all, recognition. So I think that that's why we'll be bringing in the carers passport here, so that we know who our carers are. Flexibility is so important within carers. Definitely flexibility, and just that recognition that they are that they are going to be supported, so that they're not having to choose between in paid employment and being a carer. There's no reason why people can't do both with a bit of support, a bit of sympathy, and some support from the trust and from other working carers as well.
Yeah.
Because we all have. I always say caring is a bit like a journey. We have our ups, we have our downs. There's times where it works really well. There's times that if your care breaks down, then that's when those carers are going to need that support. But it's about having those open and honest conversations, and for carers to be able to come forward to say, I'm really struggling at the moment. Actually,
Yeah.
is there anything that we can do to support me? But
Yeah.
at the moment, there is that, well, I can't say that because, I might be discriminated against, or I might be seen as a problem. We don't want that. We want to sort of, we want to look at our working carers and actually think, what are we going to do to support you?
Yeah. Yeah.
Because we actually play a really important role.
Yeah.
We are the equivalent of a second NHS. Without carers within our communities, the country wouldn't be able to manage. We just couldn't.
Yeah. You recently spoke in Parliament about your experience as a working carer. Can you
Yes,
tell
I
us
did,
a
yeah.
little bit about that?
Yeah, so it was so I do quite a lot of work and I've done quite a lot of media work for Carers UK. They always sort of try and approach me for any media work, and especially with caring. And one of the big things at the moment is actually carers in employment. Is on sort of everybody's agenda in Parliament at the moment, because what we want to do, this government is all for getting people in work, but actually, if carers are not supported in work, then it's just not going to work. We just can't do it. So they asked me to go along, and it was with Wendy Chamberlain. So she was the MP that brought in the unpaid weeks carers leave, and she's actually pushing that to be paid. Okay, so that's sort of the main focus. And for me, like especially when I was on my own with them, having an unpaid carers week just wasn't even a choice for me, because I couldn't afford to. I was I was a wager. I was sole wager, and I was on my own with two children. It wasn't an option. I couldn't do it. So I think a lot of carers, it's been proven, because we do a lot of work with Centre of Care as well in Sheffield, which is a university, and so they do a lot of research. And financially, we are already financially deprived because of the caring, because you can't do the overtime, you can't do the bank shifts, because you are caring outside of work. So financially, we're already impacted. So for a lot of carers, that just wouldn't even be an option. And she was really interested in the work that I'd done in my old trust, and obviously the work that I'm going to be doing for DCHS. And so she was really interested in that. And obviously, for us to get carers on the map, and to get a big NHS trust on the map, is really important, because actually, if a big NHS trust can support carers, then why can't other companies do that?
Yeah.
So it was a really good day, and I felt very honoured to be there, and I really felt positive afterwards. Felt that actually, we are being recognised a little bit now. From 25 years ago, we've moved an awful long way. We really have. We've come a long way. There is still a long way to go, but we're so much better than we were. I could sit here and tell you some horror stories of the experiences that I've had, looking after a severely poorly child that was in intensive care an awful lot, to trying to work as well. It nearly broke me, I'm not going to lie. It really did. And there was times where I thought, I cannot do both. And then I would feel strong again and think, no, why should I not be able to do both? This is the system failing, not me as a mother, or not me as an employer. This is the system failing.
Yeah.
So yeah.
What are you most proud of in your advocacy work? You mentioned things have changed so much. Do you have anything that stands out?
I think for me, and certainly at my old trust, was the recognition. Of like again, years ago, it was like a taboo subject that you were a carer. People just didn't talk about it. And then but to hear people, people that I'd supported in my old trust coming forward to say, actually, I've actually spoken about it and I feel so much better that my team know now and that actually I am getting the support. And that was all through the work that we had done around, supporting your mid-manager and sort of doing like, podcasts and things like that. So for me, that was a really, I always say if I can help one person, and if, one person comes to me and says to me, this has impacted my life, this has enabled me to stay in work. Because I think it's really important to remember work is always been an important part of me because it's where I can be Gemma. I'm not George's mum, I'm not George's carer, I'm Gemma.
Yeah.
And I can be me. And I think like, when my husband was dying, it was where I would come, I would be me. And I've always like used work as a bit of it's something else to focus on. And a lot of carers you would find are the same thing, are the same. They really want to stay in work and they really want to carry on working. But sometimes they just feel that they don't have that choice, and it is a choice.
Yeah.
And I think if we can make that choice happen for them, then for me that's always a plus. And if I hear of one person that I've helped that will come to me and tell me the story that they've managed to stay in employment because of something that we brought in, then every bit of work I do outside of my working hours, which is a lot of I sit at home and do a lot of this, when I'm watching TV at night and stuff. But that for me, and that's what I've always done. For me, that is like so important. Yeah.
Yeah. Can you tell us about the launch of the new Carers Network here in DCHS and what are the immediate goals for that?
So we're launching the Carers Network on the roadshow. So I'm going to be doing a 5-minute presentation. So that is the launch of it. So what we're going to also be doing on that day is we're going to be signing the Carers Pledge. Okay, so that will be with the Chief Executive of Derbyshire Carers. So that then starts the work of putting in everything that we're everything in place for the Carers Network. So that will be the Carers Passport. That will be making sure that we've got Carers Champions in each role. So I'm going to be training Carers Champions so that they can support carers within the workforce, looking at training mid-management. And I'm also going to be looking at the policy, the carers leave policy, and seeing what we can do because at the moment the carers leave policy doesn't really fit around what carers need. And yes, we have got the protected 1 week unpaid by law, but actually, let's get our carers leave fit for purpose, which is what I did in my old trust, and I've already spoken to the board as well, and sort of everybody's been so supportive. I will have to say everybody's really really up for me doing all this work. So I feel quite blessed that I've come into such a supportive organisation as well. So and then what we're going to be looking at is the long term is getting the quality kite mark carers, which is basically means that we are a supportive organisation to work for our carers. But there is a bit of work to do for that there. So and that's what I'm going to be doing. So over the next year, I'll be looking at rolling out those champions, the carers champions. I've already got a few on board. Obviously getting the network sorted out, holding meetings. Again, we've not even launched the network yet, but I think I've already had 5 or 6 people contact me to say that they're struggling. So it's obviously needed. It's needed already. So that it's really important that we get that working as soon as we can. And the very, very first thing which is all ready to go, it's all sorted, is to launch the Carers Passport, so that all managers know that we've got this Carers Passport, and we can start that quality conversation with our carers then, and look at the support that they're going to need.
Yeah, fantastic.
Yeah.
Gemma, if anybody's listening to this conversation and they are struggling to balance their role as a carer with work or other responsibilities in life, do you have any advice?
I would say speak to your manager first. I think it's really important for your manager to know that, if you are struggling, and like I said before, that caring role is a bit like a roller coaster. You are up and you are down. the times where you're classroom, you'll just be absolutely fine. It's as an organisation, we should be helping our carers. So speak to your manager. You can email into the Carers Network. I have an admin person that helps me as well. So she's been flagging anybody that's been struggling. We can get that carers passport in, and then we can also signpost you as well for the organisation, depending on where you live. So whether that is a carers conversation, whether that's looking at, the care that you're delivering, if there's anything else that's out there that could be, helpful to you. So it's, it's really important that you do speak out, because sometimes you manage, if we don't know what we don't know. And it is really difficult, because I think, again, with carers, they don't want to speak out because people don't understand unless you've been there, and I get that. But we need to make it that, we need to make it an everyday conversation. I am a carer and I am struggling.
Yeah.
So yeah, we need to make that an everyday conversation. Is that, and people are not embarrassed.
Amazing. Well done, Jemma. It's you've done so much work, and it's going to be really interesting. You'll have to come back and tell us in a few months' time how things are going with the Carers Network, and we look forward to hearing about that. Thank you so much for your time in your very, very busy
really
schedule.
I'm so excited to get everything. I really am. It's like, and I guess because I've done all this before, and we've got the accreditation at my old trust, and I knew the impact that it had on carers, and so I'm really excited to see to see what brings for DCHS, and really excited.
Brilliant. Thank you, Jemma.
You.